MATTERHORN is a phase 3 study that is designed to answer the question whether or not addition of perioperative durvalumab to FLOT therapy can improve outcomes and treat micrometastatic disease in patients with localized non-metastatic gastroesophageal adenocarcinoma. MATTERHORN is a large phase 3 study. Over 900 patients were randomized. Patients with localized non-metastatic gastric and GE junction adenocarcinoma, irrespective of PD-L1 status, were enrolled globally. We stratified patients for geographic location, Asia versus non-Asia, and advanced lymph node disease and lymph node status. Patients were randomized in 1-to-1 fashion to receive durvalumab with 3-drug chemotherapy with FLOT versus placebo and FLOT. Patients received 4 cycles of periop neoadjuvant FLOT and 2 cycles of durvalumab. FLOT is given every 2 weeks. Durvalumab is given every 4 weeks. Then patients were assessed for surgery, and after surgery, if their surgery was successful and they recovered, patients had 4 additional cycles of FLOT, if appropriate, with up to 9 additional cycles of durvalumab, so a whole year of therapy. And they were followed for event-free survival as a primary endpoint, and the secondary endpoint of overall survival and pathologic complete response. So MATTERHORN, we've presented the interim analyses before, and the first interim analysis looked at pathologic complete response. And what we've shown is that pathologic complete response was clinically meaningfully improved and statistically significant between the addition of durvalumab versus placebo. So with durvalumab placebo FLOT's cohort, we saw 19% pathologic complete response, meaning complete pathologic assessment, no residual tumor in the primary tumor or the lymph nodes, versus 7% with FLOT durvalumab. And this difference met the pre-specified interim analysis, and after that, the alpha was passed to event-free survival. So the event-free survival analysis was triggered at when at least 34% of patients had the events defined as either recurrence, progression, or death. And we did the event-free survival analysis, and as you saw in the press release and can guess based on the fact that we're selected for the ASCO plenary, this was a meaningful difference in event-free survival that was demonstrated and suggests that MATTERHORN will set the new global standard for patients worldwide. We're also presenting data from overall survival, which was a secondary endpoint of the study, and will be presented at ASCO plenary session. The most common side effects that we see, adverse events that we see with FLOT durvalumab, are related to chemotherapy. As you can imagine, 3-drug cytotoxic chemotherapy with fluoropyrimidine, oxaliplatin, leucovorin, and docetaxel can be quite taxing, and the most common side effects are diarrhea, nausea, vomiting, and neutropenia. We did not see any new safety concerns in the study, and this is an important highlight that this regimen is feasible for the global population of patients. This was a study enrolling patients worldwide in the United States, North America, South America, Europe, and Asia. Well, we're hoping that we will help patients worldwide by bringing this new regimen to the clinic. We recognize that FLOT is the new accepted standard globally. Of course, it started in Europe and the United States, and now has been adopted by many guidelines in South Korea and Japan. And so demonstrating that immunotherapy can improve survival in these patients and that it's feasible to give patients durvalumab and FLOT will change the global standard, and the patients will be able to get access to immunotherapy before surgery and before developing metastatic disease, so that we can treat micrometastasis and suppress this recurrence and prevent cancer recurrence and cure more patients. I want to thank our patients and their caregivers for their trust and their quiet victories along the way going through this regimen, because it was a difficult, certainly, time in everyone's life. We were enrolling patients during the global pandemic. And if you're familiar with the quote, this is what I'm going to use at the end of my presentation when I'm thanking the patients, from Taylor Swift. Long live all the mountains we moved. I had the time of my life fighting dragons with you.